borderline personality disorder in a romantic relationship. Maintaining a healthy romantic relationship is hard enough, even when both partners are emotionally and psychologically stable. So, imagine the difficulty faced by those in a relationship with someone suffering from borderline personality disorder. If you're listening to this, chances are you've dealt with this kind of partner before. Living with someone who has BPD is exhausting. Caught between emotional crises and manipulation, the stable partner often feels completely overwhelmed. We often associate passion with pain. In some ways, that's not wrong, especially if your partner has BPD. Slamming doors, broken plates on the floor, and manipulative crying can become your daily routine. In short, the Hollywood drama you only used to see in movies becomes your reality. Of course, how these dramas are handled and how they affect the relationship is what truly matters. Some couples might not end a fight until every plate is broken, but then they'll kiss as if nothing ever happened. There are enough examples in literature and film to suggest this is a kind of deep, passionate love. But if you're being honest with yourself, the drama in your daily life usually isn't very romantic or beautiful. In the long run, this kind of destructive behavior is more likely to lead to a breakup, and that's in the best case scenario. Arguments, fits of rage, and tears can be stressful phases in life, but they can also be signs of a clinical disorder like borderline personality disorder. People with this disorder feel everything to an extreme. They can be angry, depressed, but also hypersensitive. In reality, they can't properly regulate their own emotional world, which can cause serious problems within a relationship. So, what does this disorder actually look like? Stress can take many different forms. Everyone experiences it at some point, whether at work or in their personal life. If there's no way to balance it, like with sports or relaxation, it can lead to an overreaction. It's what we call the straw that breaks the camel's back. Often, the person can't even express their feelings because they don't really know where they're coming from. Prolonged stress can also lead to more serious issues. For example, depression can result from long-term emotional strain, but that's a distinct clinical condition, not just instability. The same goes for anxiety disorders, which can cause impulsive behavior, though it's often more about avoidance. But there is a diagnosed clinical condition that is at the root of emotional instability, emotionally unstable personality disorder. This is divided into two subtypes, the impulsive type and the borderline type. The impulsive type is characterized by impulsive actions and extreme mood swings that people can't really control. The borderline type has these same symptoms, but with the added features of a distorted self-image and destructive behaviors. The person is caught between a deep need for closeness and the inability to tolerate it. They live in constant fear of abandonment. Understanding emotionally unstable personality disorder. One key difference is that with stress-related instability, there's a clear trigger. When the stressful situation improves, the person's behavior usually returns to normal. Depression and anxiety can also often be traced to specific causes, and the symptoms frequently improve with medication or therapy. This isn't always the case with borderline personality disorder. The symptoms can't be pinned on one specific factor. People with BPD often suffer their entire lives. From the outside, it might not be clear at first if you're dealing with a serious mental disorder or just a very stressed person. Because of the nature of the disorder, those affected also tend to attract or unconsciously enter stressful situations, which is especially true in a relationship. As the relationship deepens, most partners eventually realize they are with someone who has BPD. The person with the disorder can't help it. It's caused by either genetics or environmental influences in childhood. To this day, researchers still don't agree on the exact factors. Psychotherapy can lead to improvements over the years, but relapses into old behavioural patterns are always possible. People with BPD often describe feeling an immense inner emptiness that they can't seem to fill. Through extreme, often self-inflicted situations, they try to fill that void with feelings. However, this usually only works for a short time. A tendency for self-harm is also common, and they may cut themselves with sharp objects to find relief. A relationship with an emotionally unstable person can be exciting at first, but incredibly difficult to sustain in the long run. What is a relationship with a person with BPD like? A relationship with a BPD partner is often hard to maintain, which is why it usually ends badly. The partner with BPD often can't handle closeness, even though they desperately crave it. This creates a push-pull dynamic where they do everything to draw their partner in, only to push them away again. Furthermore, the BPD partner repeatedly provokes situations that lead to massive arguments, sometimes out of nowhere. This creates an enormous burden for both people because the partner with the disorder also just wants to be loved and accepted. Above all, they don't want to be abandoned. As a result, they will try to bind their partner to them in any way they can, in extreme cases, even with threats of suicide. Let's look at some specific behaviours. 1. Instability due to stress. As mentioned, when instability is caused by stress, there's usually a temporary factor. Once it's gone, your partner's irritability should decrease. However, you have to ask, is the cause really just temporary? A serious conversation is unavoidable. A crisis is often the first signal that the stress is becoming too much. It's always best to react to warning signs early before they develop into a more serious condition. 2. Manipulation through crying. Someone who cries often might just be particularly sensitive. On the other hand, it could be a sign of depression. In that case, the sadness is persistent and the person feels little energy for life. Joy disappears and life seems meaningless. The only thing that can help here is talking to an expert like a psychologist or a doctor. Unfortunately, there are also cases where people have learned to use tears to get their way and avoid problems. You'll notice this when arguments are never truly resolved and you always feel like you're the one giving in. This is a classic form of manipulation. This reflex is often unconscious and learned in childhood. Behavioral therapy can help develop better conflict resolution strategies. 3. Manipulation through anger. Unlike depressive moods, which might show up as crying, some people express their turmoil through anger. In extreme cases, this can be combined with alcohol and led to violence. However, if your partner only has occasional angry outbursts and calms down quickly, you can try to give them space when you see a storm brewing. Of course, angry behaviour is never an excuse for insults, and certainly not for violence. 4. The clarifying conversation. Perhaps you don't even know how to start a conversation with your partner. Try to keep it as factual as possible to avoid manipulation and crisis. This means you don't make accusations. Your partner will surely understand that you are suffering from the tense situation. From there, you can signal that you are still there for them, but that something needs to change. Tell them that living this way has become impossible for you. So what should you do? There's really only one way forward: therapy. Both couples therapy and individual therapy. The partner with BPD needs it to treat their disorder. The other partner needs it to learn how to care for their loved one and for themselves. It gives them a space to discuss their fears and understand them. Should you end a relationship with a person with BPD? When you're in this kind of relationship, two questions are always on your mind. Can I end this, or will it make my partner's condition worse? And what if my partner hurts themselves because of me? These are the thoughts that run through the minds of most people in a relationship with a BPD partner. But you have to decide for yourself if you have the strength to keep fighting, or if you're completely exhausted and at your limit. Stormy relationships like this consume a lot of energy. It's right and important to care about your partner, but you must first take care of yourself and make sure that you are okay. Often, you can only do that if you break contact and spend time on your own again. What you can do is offer your support, but from a safe distance. Remember, your self-preservation comes first. If you genuinely fear for the other person's life because they have repeatedly talked about suicide, you should speak to a doctor or a mental health professional. Yes, you're a couple, and couples stick together. But in many cases, people simply need professional help. No matter how much you want to, you cannot save your partner.